Good afternoon, everybody. Welcome to the 2024 UW System Caregiving Spring Forum. And we're delighted to welcome everybody today for a talk with Jessica Lee for a presentation entitled Title IX Pregnant and Parenting Students. My name is Stephanie Bertolotti. My pronouns are she, her, and I am the director of the UW System Gender and Women's Studies Consortium. My office has been part of the University of Wisconsin system since the 1980s. And I do outreach and support for all of our gender and women's studies programs and departments on all 13 UW system campuses. And because our programs and departments are interdisciplinary, we also do a great amount of work as a consortium with all of our affiliate partners, campus centers, and other stakeholders across the state. And we're really delighted to welcome everybody to our Caregiving Task Force Forum. The Caregiving Task Force was an initiative that was co-convened and co-sponsored by the UW System Gender and Women's Studies Consortium and the UW System Ideas Alliance when the pandemic began in the spring of 2020. And the Caregiving Task Force wanted to build on initiatives to support caregivers across all 13 campuses that were already in place, and also provide opportunities to have conversations and policy changes on all of our campuses in direct response to the pressures that a lot of caregivers were feeling across UW system because of the pandemic. And during the first 2 years of the Caregiving Task Force, we were able to assemble representatives from every single UW system campus from all levels. So we had administrators as part of our task force. We had a lot of faculty, academic staff, university staff. We had students, and we had a lot of robust conversations in the first 2 years about what does policy change look like if we're placing caregivers at the center of the conversation. What does student success look like if we're thinking about the needs of student caregivers, and what can we do collectively and on our individual campuses to make sure that caregiving is something that remains on our radar and a concern both during and after the pandemic, as critical to our success as communities, campuses, and places to support student growth and success in a variety of capacities. And today's presentation feeds directly into this conversation and a lot of the support that we've had for student parents as well. We put a link in the chat that shows, that provides information on the Caregiving Task Force and some of the initiatives and surveys that we've created. And what you'll see when you look on our website is a focus of the Caregiving Task Force has been twofold. It has been to think about caregiving intersectionally, both in terms of the identity positions of caregivers and who they are on our campuses and the other barriers that they face and the perspectives that they bring to our campuses. And then it's also been to think about caregiving itself intersectionally. A lot of our caregiving conversations focus on the needs of parents of young children, but as a task force, we were also focusing on elder care. We were focusing on support for family members of children with disabilities and also for students who provide care for siblings and parents at home. So the intersectional focus was twofold in the Caregiving Task Force. And then the other focus was, again, to have these conversations where we can come together and think about, as a system, what can we do to continue to talk about caregiving and move it forward. I just wanted to pause for a moment to provide a few logistics for the call today. We are in Zoom webinar mode, so there is a Q&A box, and as Jessica is going through her presentation, there'll be some interactive components, and there'll be also an opportunity for you to put questions in chat. You can put questions in chat anonymously, or you can identify yourself, but we will at the end have a facilitated Q&A, and we will keep all of the comments and questions anonymous at that moment. So feel free to use that throughout the presentation. If you need to chat with us directly, you can use the chat function, but again, the Q&A box is for questions at the end. And we will reserve about 15 minutes at the conclusion of the presentation for any specific scenarios or questions people want to ask. So at this point, I am going to turn things over to the two co-chairs of the System-Wide Caregiving Task Force. And first, we will hear from Dr. Jenny Shuttlefield Christus, who is a professor of chemistry at UW Oshkosh and the director of the UW System Ideas Alliance.
Hi, everyone. Welcome and thanks for attending today. As Stephanie said, I am Jenny Shuttlefield Christus. My pronouns are she and her, and I am the director of the Universities of Wisconsin Ideas Alliance, or formerly you might know it as the Women in Science program that was established in the 90s. And the Alliance mission is to create a more inclusive and diverse and equitable environment in our STEM education community, not only just within the universities of Wisconsin, but also the Wisconsin community. We promote the application of evidence-based practices in STEM education and try to catalyze systemic change and advances in STEM fields and our practitioners. And we offer a number of programs throughout the year and collaborate with the Women and Gender Studies Consortium and activities like this caregiving task force, and also offer small grants for instructors to make changes in their courses across, again, the universities of Wisconsin in support of the mission throughout the year. So the caregiving issue has been noted to be really significant for STEM focused employees. And so I am very excited to welcome our speaker today and look forward to hearing this presentation. So Rachel, I'll turn it over to you, or Steph, maybe going back to you. I don't know.
Go ahead, Rachel.
Okay, thank you. Hi, everyone, and happy Friday. My name is Rachel Kubzak, she, her pronouns, and I'm the program lead for the Student Parent Success Program at UW-Milwaukee. The Student Parent Success Program is a holistic student support program for UWM students who have children. We provide wraparound supports that include coaching, events and programming, and connections to campus and community resources. We're really lucky at UW-Milwaukee to have so many engaged campus partners who help to elevate our mission of supporting student parents and creating an inclusive campus environment for our student parents, including our Child Care Center, the Children's Learning Center, the Women's Resource Center, and our Dean of Students office, to name a few. We have talked on the Caregiving Task Force about hosting a Title IX forum for a while, and so I'm just thrilled to be here with all of you today. So thank you for joining us.
Great. Thanks so much, Rachel. And Rachel did put a link in the chat, a form for the Caregiving Task Force. And if you are interested in participating, the commitment is usually 1 meetings per semester, and then we have committee work. So if you choose to join a committee or there's an issue that you really want to develop on your campus or system-wide, that's an opportunity. You can also join the task force to just be a conduit to your campus for providing information when we're hosting events like this, or if there's other work that people are participating in across UW system and beyond. So if you have any interest, go ahead and fill that out, and I will contact you and we can have a conversation if it sounds like a good fit. So at this moment, I am very excited to welcome Jessica Lee as our guest for the Spring Forum. As Rachel mentioned, Jessica has been somebody that we have really wanted to engage in a larger conversation with task force members and across UW system, really since the inception of the task force in 2020. Jessica Lee is a senior staff attorney at the University of California College of Law and San Francisco's Center for Work Life, and also the director of the center's Pregnant Scholar Initiative. And we're going to put a link to the Pregnant Scholar Initiative in chat now. And when the task force was starting, this was one of our primary resources for looking at ways to support student caregivers, employee caregivers, faculty caregivers across UW system. And the website provides a lot of legal resources for the rights of pregnant and parenting students, and is useful for students, postdoc, faculty, administrators in all different types of higher education institutions, and is just really a wealth of resources. And as you can see from the website and from Jessica's profile, her focus is really intersectional approaches to equity for students, pregnant and parenting students, as well as a really tangible overlap of employment, education, maternal and infant health. And what you can see from a lot of the materials on the website and conversations that Jessica participates in is her work provides a lot of tangible tools for organizations and campuses to think about how to support students who are pregnant and parenting, students who are breastfeeding, and what the implementation of those policies can look like when campuses are working on strategic plans, when campuses are thinking about what student success looks like at the junction of admissions and beyond. And we've used used a lot of these materials and resources as we've bridged into conversations of what support for students can look like and how it's going to look different on all of our campuses, where we have different demographics, different campus sizes, and different histories and dynamics feeding into these conversations. Jessica has also helped with legislation and modeling draft legislation at the state and federal level. She provides consulting and outreach to state and local agencies. And again, a lot of really comprehensive training tools for organizations and higher education in all forms to support pregnant and parenting students. So I'm going to turn things over to her. But again, I wanted to express my gratitude and excitement to hear this presentation today. So thanks, Jessica.
Thank you so much. It's such a pleasure to be here. I was actually taking some notes on your programs. Very rare that I start off a presentation taking notes, but I'm just so thrilled that you all are engaged in such important work around caregiving, especially doing it across the system. That is such a rare treat, and it sounds like you all are ahead of the curve, addressing these issues and supporting caregivers on your campus. So extra excited to be here with you today. And as was just said, I am Jessica Lee. I run the Pregnant Scholar Initiative at the Center for Work-Life Law. In that role, I engage with policymakers, advocates nationwide. I support Title IX coordinators with technical assistance and training. And then we also run a helpline for pregnant and parenting students who are facing challenges at school. So I'm thrilled to be able to share with you some lessons that we've learned through that work, especially in light of some changes that are going to be occurring in the law. You'll see there's a QR code on your screen. I'll also give that to you at the very end of the presentation. We have there a link to a PDF of my slides. I'll make sure that's also shared along with the recording today. And there's also a sign-up form if you're interested in getting all of our latest materials. That's where you can go to share that interest or share comments or questions that we might not get to today. Though it sounds like we have a good chunk of time for questions, so I'm really excited to have these conversations with you. All right, let's dig in. On the agenda for today, I don't expect you'll walk away from this being lawyers, but I hope you'll be more familiar and comfortable with Title IX as it applies to pregnant and parenting students. I'm also hopeful that the presentation today is going to help you identify some ways to help bring the law to life on your campus. So first, we'll go through an introduction, talk through the general scope of Title IX for those of you who aren't so familiar, go through pregnancy accommodations, parental leave and absences. We'll tie it up talking about harassment and discrimination, and then we'll close and get to those questions. First, I'll just start off with a quick reminder about the student population that we're discussing today. Of course, many students become pregnant each year, but thinking specifically about student parents, 22% of undergrads nationwide are parenting students. And we see about 31% of graduate students are parents. So this is a very, very sizable population in most places. Really curious if anyone has the stats on the number of student parents in the University of Wisconsin system. I would love to know that and put that in the chat. Most places don't have a really good count, but the best numbers we have say between 1 in 4 to 1 in 5 undergrads are parenting, which is huge because we don't talk about them quite so often. Another reason this population is so important to center is that 51% of student parents are people of color. That's actually about 40% of Black women undergrads are moms. So as you're thinking about racial justice, as you're thinking about those DEI initiatives, which I know are really fraught these days, we want to pay very close attention to this population and making sure that they are centered in our work, that we're not forgetting the needs of our parenting students. And here's a part of why. Parenting students end up graduating with about twice the student loan debt of other students. But that's if they graduate at all. about less than a third actually are able to graduate in 6 years nationwide. So that's some pretty stunning statistics that I think are particularly shocking in light of the fact that student parents on average actually have higher GPAs than their childless peers. So there's a real disconnect here. I know the student parents I've worked with are incredibly motivated, driven, smart folks, but they are facing a mountain of barriers. Here are some of the common issues that we see. We see a lot of these come up on our helpline. As mentioned, the Pregnant Scholar has a helpline for pregnant and parenting students, and we regularly hear from student parents who are feeling stigmatized because they've had an abortion, or because they're pregnant, or because they're a dad who wants to be active in their kid's life. We see them being prevented from taking the courses that they need or want. Unfortunately, all too often being forced to withdraw or prevented from finishing their courses. Challenges navigating absences are probably the #1 issue I see. But there's all of these barriers, and they impact people's choices about their health, their family. They impact whether a student can continue their studies, if they can continue and complete their education on schedule. So I'm so glad you're here today, because I know that so many of you are actively working to break down these barriers. But I'm also curious if there's any, if there are any student parents in this virtual room. If you're comfortable sharing, I'd love to hear any barriers that you've overcome. What you see here is largely the low-hanging fruit. Obviously, I'm leaving off childcare, housing, but I flag these particular barriers because they can be addressed often in the very short term and with very little cost. These are the barriers most likely to be connected to legal rights, like rights under Title IX. And that's going to be my focus today. So acknowledging, of course, we're not going to be able to fix this whole ecosystem. We don't have a magic wand we can use to fix our housing, childcare, paid family leave crisis in this country, but there are certainly changes that institutions are expected to make under Title IX. So let's dig in. The most useful law that we have on this front is Title IX. Now, the actual statute is only 37 words. Very, very tiny law with huge implications. The vast majority of what I'm about to share about the law stems from the implementing regulations on Title IX. Now, those regulations have changed very little in the past 50 years, but this year we're getting updates. So as I go through the law, I'm going to share with you a few things that have changed. So I hope this is relevant even to those of you who are very well practiced in Title IX. We are expecting that those regulations will be formally enacted this spring. We've been waiting for these changes. They've been promised for over a year now. But the Department of Education has finally taken the steps necessary to have those regulations be officially codified. So let's dig in. Start off with the basics. Who is covered? Title IX covers students, trainees, also employees in K-12 colleges, universities. The short answer here is that your university is covered under Title IX. But where are folks covered? Where are they protected? Title IX has requirements that apply to pretty much any programming sponsored or required by an educational institution and overseen by that institution. So we hear a lot about Title IX in relation to athletics, but it's not just athletics, it's classes, externships, internships, extracurricular programming, or training. They are all covered under Title IX. And then how are they covered? That's what we're going to spend the most time on today. Title IX prohibits discrimination on the basis of sex and pregnancy-related conditions, and it requires certain accommodations. So here's what I mean by that. The rules make clear that discrimination on the basis of sex is prohibited under federal law. that has been interpreted to include discrimination on the basis of pregnancy. So anywhere you read or think about discrimination on the basis of sex, that also means discrimination on the basis of pregnancy, which we unpack and see includes all of these conditions: pregnancy, childbirth, termination of pregnancy, which is a legal term for abortion or miscarriage, lactation, related medical conditions, and recovery from those conditions. It also includes somebody's current, future, or past conditions related to pregnancy. So a student who's undergoing IVF, a student who's pregnant, someone who's not pregnant anymore, they're experiencing postpartum, all of them are protected under this law. Flagging here the parts of the definition that are new in 2024. The law has long been interpreted to include these particular conditions, but the new regulations are finally spelling that out. Next, the law also protects parenting students, although a little differently. We'll talk about that today. But discrimination against students on the basis of sex and parental status is prohibited. You have to have both of them together. So again, anytime we're talking about discrimination, we're including someone being discriminated against on the basis of sex and being a parent, whether they're an adoptive parent, foster parent, a guardian, or somebody seeking to become someone's guardian. They are all covered. And all of these various types of caregivers have long been protected in our interpretations of the law, but again, actually spelling this out is new. One last basic principle here to discuss is violations. What happens if someone doesn't meet all of the requirements I'm going to go through today? Well, in that case, a student can file a Title IX complaint at their university. A lot of folks are, of course, familiar with that and what that might mean, but I do want to flag for you that the updated regulations make clear that Title IX offices have to have a complaint process that is accessible to students who are experiencing violations other than sexual assault. So a lot of folks have been really laser focused on assault, on harassment, but Title IX pregnancy and parenting protections also mandate that there be a complaint process for those students as well. And we're expecting to see in these new regulations that some more clarity, that employees must report sex discrimination, not only sexual harassment or assault. So when those new Title IX proposed rules come out, officially are on the books in hopefully the coming month, those regulations are going to have a little bit more detail about mandatory reporting, and we expect that to include not just sexual assault and harassment, but this broader definition of what sex discrimination is. Another option, if Title IX is violated, is for the student to file a complaint with the Department of Education. And then a student can file a lawsuit. Now, we're all here because we want to avoid that. And thankfully, I'm not a lawyer who sues. I'm a lawyer who tries to prevent those problems in the first place. So let's talk about the obligations and how to meet them. We'll start first with pregnancy accommodations. I'm going to go in chronological order here. Pregnancy coming first. I say accommodations because that's the term that we use in employment, but you might also see them referred to as adjustments or academic modifications. And that's just fancy legal terms for changes, modifications in the student's education, changes to the policies that are made to protect that student's health in light of their pregnancy or related conditions. And here, unfortunately, is a real quote. There was a student I was working with. She was going back to school after some pretty serious complications post-childbirth. She was really struggling and she asked for help. And her mentor and advisor's response was, "Hey, you don't have a disability. You just need to go home and be with your baby." We're not going to do anything different here. If you need help, just take more time off, right? Don't continue your education. And that's what we don't want to see. Thankfully, there are some guidance, some guide rails there to help you get this right. So again, accommodation, adjustments, modification, whatever term you want to use, this isn't complicated. Students don't have to be in the hospital. They don't have to have a disability or even a formal diagnosis. If a student comes to you saying any of this, it's probably because they need an accommodation. A student might reach out saying, I don't fit in my chair. It's hard for me to type. Is that safe? They might share with you that they were in the hospital or that their doctors advised them to make some changes. Or maybe you're just seeing some changes in the students, like maybe they're getting up and leaving for a lot of bathroom breaks. They're struggling to keep up. Maybe they have sudden unexplained absences or tardiness. Now, I'm not suggesting anyone reach out to the student and say, hey, are you pregnant? Here's a test. But I do want to flag that, these are not necessarily student failings, but there might be a sign to you that there's an opportunity to help through making some modifications. Some examples of pregnancy-related accommodations include delayed deadlines, more bathroom breaks, especially during exams. Those can be tricky. Permission to eat or drink in class, a different parking space, avoiding toxic substances. This is a big one for students in STEM. Remote learning or remote testing options, or a larger chair so the student can sit more comfortably. And I include the picture of these desks with the writing component attached. I know that is a nightmare for very pregnant students. A lot of these seem pretty simple, right? Even the chair, that seems simple. It seems like a no-brainer, but I have seen this in my own work where folks are not able to have a seat that fits their needs, that fits their pregnant bodies. And this is that even came up in an investigation from the Department of Education last year. I see a comment in the chat. I don't know if everybody can see this, but somebody said those desks should be banned. Yes. If any of you feel like sharing, I would love to hear if you needed changes at school when you were pregnant. I think a lot of us don't necessarily think to ask, but I am very curious if anybody out there has been asking. And somebody did flag in the chat, a huge challenge for parents and students with special needs concerns is inflexible attendance policies, both for work and taking classes. Absolutely, and we're going to talk about that a bit today. So here's what the regulations, the Title IX rules, have to say about accommodations. For a long time, they've used some language that's a bit obtuse, saying a student has to, or a recipient, excuse me, an educational institution has to treat pregnancy and related conditions in the same manner and under the same policies as any other temporary disability, meaning you have to provide reasonable academic adjustments. But that's not very clear. It's not very direct. They got a little bit better with some guidance that was put out a few years ago saying to ensure a pregnant student's access to the educational program, when necessary, a school must make adjustments to the regular program that are reasonable and responsive to the student's temporary pregnancy status. Again, not the most straightforward language, but you're getting the point, right? You have to make those changes. Unfortunately, with that language, a lot of institutions don't have clear policies. Just sharing a few things that I've heard on our helpline. We see students who reach out to a faculty member, and instead of being directed to the right process to get the adjustment they need, we see negative statements about their pregnancy. We hear from a lot of students about questions about the student's family makeup, intrusive medical questions. I've even deans asking why a student wasn't on birth control. And really the clincher here, the one that I hate the most that we unfortunately see very often, students being told you should just withdraw rather than actually taking the time to walk them through the process to get the help that they need. And this is why it's so important that you all are engaging in this work to raise the profile of student caregivers on campus and to help provide some guidance for folks who are in the middle of this. When it goes wrong, it goes very, very wrong. So here are the new, here's the new language that's going to be in the upcoming rules. Reasonable modifications to the recipient's policies, practices, or procedures for a student because of pregnancy or related conditions must be provided on an individualized and voluntary basis. So in the upcoming federal Title IX rules, the Department of Education is now going to be much more clear about what must be provided. They're also going to give a bit more guidance on how. And part of that is to make sure that faculty who, let's face it, they're often not trained and they're really stretched for time, aren't the ones managing this on their own, and to be more clear about how this should be handled. We've been calling for, gosh, about a decade for the Department of Education to say more clearly who's responsible for this. Really thrilled to see that they're finally putting that to paper, that the Title IX coordinator is going to be responsible for communicating to pregnant students their rights and overseeing this interactive process to provide accommodations students need. So before, a faculty member might learn of a student's pregnancy or their need and send them home, send them to the dean of students, send them to disability services, who knows, right? I tried to make a flow chart of the common pathways I see, and it really just, it looked like a tornado, right? Students are going in every direction. Now it's a very clear-cut process. The faculty member, if they're approached by a student, should then refer the student to the Title IX officer or their designee. That person would then provide information about pregnancy accommodations, leave, lactation accommodations. They would oversee an individualized and interactive process to establish those adjustments, and they're responsible for addressing any complaints. The Title IX coordinator, of course, could be doing this in concert with the accessibility office, with whoever's managing 504 or others. But the ultimate responsibility under the new regulations, as proposed and what we expect to see, is that the responsibility will lie with the Title IX coordinator. So big shifts here in terms of who's responsible. I'm hoping the clarity helps make it easier, not harder. Love to hear in our question session what your existing practices and any light I can shed on how to get it right if you're making changes. So here's the way this would work when you're in that interactive process, the key factors and the accommodation decision. First, that threshold hurdle. Is there a need that's related to pregnancy? Almost certainly yes. The next question is a little bit trickier. Is the accommodation responsive to the impairment? Here's what I mean by that. If we have a student who's asking for a remote exam because they have pregnancy-induced carpal tunnel syndrome, that doesn't seem responsive, right? But of course, that would be responsive to the student's health needs if they were on bed rest or if they were still recovering from childbirth. The next hurdle is whether the adjustment or accommodation is reasonable. And that means it doesn't cost an unworkable amount of money and it doesn't fundamentally alter the nature of the course. So thinking again about a request to have a virtual proctoring of an exam, that would be reasonable for a lot of lecture classes if it's responsive to the student's need. But it wouldn't be reasonable for a nursing clinical course where the entire point of the class or the exam is to get in-person patient contact and to test the student's ability to conduct certain exams, right? So that's what I mean. Is it reasonable? Is it tailored to the student's needs? Is it actually responsive to the academic requirements and goals of that course? And that's something that the Title IX coordinator or their designee would guide faculty members through discussing, would figure out whether it is responsive and reasonable in that particular circumstance. So there's no one size fits all approach. This is all supposed to be interactive. In the situation where the adjustment requested would fundamentally alter that class, if it's not reasonable, the institution still has a duty to explore other options. So maybe it's not possible to have that virtual exam proctoring, but maybe they can delay the exam a few weeks, or give the student an incomplete so they can come back and finish it later. Maybe there can be another testing accommodation that actually addresses their health needs without being fully virtual. That's part of that interactive process, figuring out if there's a plan B or C or D that would meet the student's needs if that first adjustment just isn't workable. Okay, that was a lot. Please, please, please. I see there's some questions. I want to stay on track here, so we'll answer them in the Q&A section, but take a second to jot down your notes. We're mostly focusing on students here today, but I do want to flag for those of you who are in positions to supervise others, or maybe you're expecting yourself. There are also Title IX employment protections, and those apply on top of the requirements of 2 new laws that went into effect last year. My team works on employment issues as well. We have been extremely busy managing all of this at once. Because I'm not spending a lot of time on this, I am including some links here for further reading. So first, lactation breaks for employees are expected to be in the new regulations too. Thankfully, those proposed rules match the new Federal Pump Act requirements. So if you've been paying attention to the Pump Act, you're already ahead of the curve there. You're ready for the new Title IX rules. They are going to require break time be provided as often as needed, and a private non-bathroom space for expressing milk. Next, their other pregnancy accommodations are required by the new Federal Pregnant Workers Fairness Act, also went into effect last year. And just like we talked about those reasonable accommodations, those adjustments for students, employees now have a right to the same. That can include anything from leave to duty modifications, change work site, new desk, whatever that person needs that's responsive to their health, so long as it doesn't cause an undue hardship. So I have some links here, happy to address questions about that in our Q&A section when we've met the student needs, but I do want to flag this for you. I also think it's really important to remember that these apply to student workers in their employment capacity as well. So this is not just faculty, not just the full-time staff. There's no requirement that an employee have been employed a certain amount of time to be eligible for this. If any worker is covered by this. So if there's a student worker who is on the clock and they need an accommodation for their time spent working at the library, for example, they would be covered under these laws. But when they're in their lecture classes, they're just relying on Title IX. Student protections, different section. All right, what's next? If your head is spinning, if you're bracing for impact of these regulations or feeling behind, just a reminder on some starting points here. Really, you can make some incredible strides just by assembling that dream team. It sounds like you all have some great folks who are working together already. Gather your people. Next, you want to make sure that students know how to reach those points of contacts. Designate those points of contacts. Make sure everybody knows, right? Maybe you don't have a clear pregnancy accommodation process that everyone's been trained on yet. At bare minimum, if they know how to reach the right person, that's a great way to help prevent violations. Next, you want to make those quick website tweaks, update your webpage, update your complaint forms to mention pregnancy and related conditions. prepare for that increased demand for lactation spaces. That's both for employees and students. I can tell you the call volume to our employee helpline jumped about 400% when those new laws went into effect. People are starting to find out about their rights and really demand them. So map those existing lactation spaces. Assemble your dream team who works on finding new spaces and getting access to them now. And generally, just make sure you're taking some time to assess and know where you stand. What's there? What needs to be created? It can definitely be a long process, but if you're doing this, I think you're going to be off to a good start. Okay, let's switch gears a tiny bit and talk about student leave. Here's another quote from the student saying, "I was in a lot of pain, and I remember thinking to myself, I shouldn't be here." This student had just gone back after a very challenging C-section, was not recovered. She could barely walk, but she didn't think she had a choice. We weren't able to get the poll working quite right under this, but if anyone wants to take a stab at this, I would love to know what you think, or if you have a policy there. How long is student maternity leave? Also convenient for a cough break. Six weeks. I think that's directed to hosts and panelists only. So I'm seeing a lot of 6 weeks, none, as long as they want, a month. I love the variation here. One class. And I'm glad folks are thinking about it. And I really appreciate folks who say they just don't know. I think at most institutions, that's the case, and nothing to be ashamed of, because we have not made this clear enough. In the academy, everybody just kind of assumes you figure it out, get back to work as soon as possible. So here's a shocker. The people who said as long as they want, they're right. Here is the text of the current Title IX rules that say leave of absence must be provided for so long a period of time as is deemed medically necessary by the student's physician. And for the last several years, I've actually included this screenshot of the old typed up regulations, because folks literally just did not believe me that for the last 50 years, federal regulations have required student maternity leave. And this leave is for as long as medically necessary. So that is determined by the student's physician. And that can include leave or excuse absences for doctor's appointments, pregnancy complications, childbirth and recovery, or abortion or miscarriage care or recovery. So any of those pregnancy-related conditions, if a student's healthcare provider says it's medically necessary for them to take time off, so that they can meet this treatment plan, so that they can stay up on their care, so that they can avoid complications, whatever it may be, if that physician says it's medically necessary, the institution has to allow the student to take time off or miss class. Of course, the trickier part, much more trickier than leaving, is returning. Here's what the regulations have to say about that. Guaranteed readmittance to the program has to be provided. Can't charge new fees, say, we might approve you to return after you recover from childbirth. No, that spot has to be held for the student. We also shouldn't be seeing any penalty or grade deductions. This is often an issue where professors require participation for certain credits, or they don't allow the student to make up exams or in-class work. that would be a violation of Title IX. Under Title IX, students must be allowed to make up credits missed while they were out on medically necessary leave or absences. And then finally, I see this a lot with grad programs and professional programs requiring medical certification. That can be requested prior to return, but with some limitations. And under the new rules, those limitations are going to get even stronger. So should be pretty rare that a student should have to submit lengthy medical certification. So the new regulations, for those of you who are familiar with the old, they switch it up a tiny bit, but they still continue that medically necessary provision. So time off has to be provided for as long as medically necessary for all covered conditions. So that could look like a professor not applying their typical attendance policy and saying, yes, this is automatically excused. It's okay that you missed a couple of classes while you were really struggling with that health condition. I'll excuse it under Title IX. Or it could look like a student who needs a lot of time off and they then get an incomplete, continue that work later once they've recovered. Or maybe the student needs to withdraw, but they have that guaranteed readmission. I do expect that the Department of Education might have some changes when it comes to intermittent absences. Folks in the federal space here did a lot of comments on that particular part of the provision, so I can't say with any certainty what they're going to come down and say. So definitely stay tuned and look really closely at that when it comes out. The new regulations also make clear that students should be returned to their same extracurricular status to the extent practicable. Those of you who work with athletic programs, definitely check out the NCAA guidance on that. They have a really, really helpful toolkit. I think the new Title IX regulations are going to be in sync with that. And then, as I mentioned, there's going to be a much more narrow ability to request documentation from students when they return from this Title IX leave. Okay, deep breath. Now we're going to employee maternity leave. Again, primary focus here is students, but I did want to at least flag for you that Title IX also covers employment leave. Title IX requires job protected leave be provided for at least a reasonable period of time, and that does include student employees. This is, of course, on top of leave that's already provided by temporary disability policies, the Pregnant Worker Fairness Act, which I mentioned earlier, the ADA or FMLA. This is not paid leave unless there's another type of leave that is covering this, like temporary disability policies. But I always want to mention this because I know that a lot of folks in this work, particularly students, are not eligible for the FMLA because they haven't worked for the institution long enough. Title IX would apply regardless of how long they've worked there. So if somebody that you're supervising or working with needs time off, they don't have enough paid time off in their bank, they don't have any days to cover it, their job still has to at least be held for that reasonable period of time. If you're like me, at this point, you're probably questioning, what about parental leave? I know we've talked a lot about maternity leave. What about everyone else, the non-birthing students? Well, this is where Title IX, frankly, really falls short. The law is overwhelmingly focused on the birthing parent and their own medical needs. It is not written with broader caregiving needs in mind when it comes to the specific section on accommodations and leave. So student parents who aren't giving birth, but who nevertheless, maybe they want to be there for their kid, or unfortunately, maybe their kid's in the NICU or struggling with a health condition. They do not have a mandated right to leave. Like, that medically necessary leave does not apply when we're talking about somebody else's health condition. But basic non-discrimination rules still apply. So Title IX doesn't specifically require leave other than medically necessary leave for the pregnant or birthing student. Caretaking or bonding leave, however, does have to be provided equally without regard to sex or gender. So that means it's okay to provide disability or medical leave for a birthing parent. Hey, take as much time as medically necessary. Maybe that's 6 weeks to recover from birth. But it's not okay to say, oh, yes, you just had a baby. You can take a year. But to deny the non-birthing parent or the father to have that same caregiving leave. If it's about taking care of a child or a family member, it has to be provided without regard to sex or gender. What's next here in terms of meeting those obligations? Again, you have a little bit of a head start before the new rules come out. Again, assembling that dream team, assessing your current policies are really important. Definitely pay attention to what is in your existing medical leave or withdrawal policy. I see a lot of those that seem like they weren't written with Title IX in mind. And so you want to make sure that you're directing folks to the right policy. And then again, look very carefully at the new Title IX regulation language about what must be provided when that comes out. I feel pretty confident about everything I shared with you today, but I know when it comes to leave, the devil really is in the details. So read that closely, and I'll also be sure to send our lovely hosts an update when those come out. All right, last section, and probably the most entertaining, if not stressful, is non-discrimination and harassment. This is the last big ticket item here, is non-discrimination itself in the broadest sense. I see a lot of really harassing statements being made to pregnant and parenting students, and I'm going to share some of them in this section, not to dwell on the negative, but just to flag that even at the most wonderful institutions, folks can say things that make the environment unwelcoming for those students. Like this professor who said to their student, "I thought you were a serious student. I'm so disappointed." That was their immediate reaction when they found out that their mentee was pregnant. Again, looking back on those basic principles, any pregnant or birthing student is protected. There can be no discrimination based on pregnancy, intent to be pregnant, past pregnancy, including being a parent or having an abortion. And again, sex and parental status matters as well. So discrimination on the basis of parental status that treats people differently based on their sex or gender would also run afoul of Title IX. So the primary question we're asking with Title IX when it comes to discrimination against parenting students is still, are students being treated differently on the basis of sex or gender? But we think really broadly about that question. And you have to consider new thinking about gender roles. And that is also reflected in the new Title IX regulations. So we don't want to be treating students differently on the basis of pregnancy-related conditions. We also don't want to be treating students differently on the basis of gender roles. So if you're in a situation where you're seeing it being flagged that, what does it mean to be a good man, a good woman, a good mother or father? Is a good scientist someone who's not a mom, who doesn't want to be at home with their family at 9 o'clock at night because they should be in the lab, right? And we also want to pay attention to those sex-linked stereotypes about parents, their competence, availability, or commitment. Here are some examples of what I mean. Often that comes up with folks being cut out from opportunities. I call it the benevolent roadblock. I think this is probably the most common, especially on campuses that have done some work around including caregivers. We often see folks say, "Hey, I know your priorities have changed, so I took you off of this assignment," or "Don't think you need to go to that conference," or "Pregnant women can't handle this lab assignment," right? They think they're helping. In reality, they're limiting somebody's educational opportunities, which is unfortunately, of course, a Title IX violation. We see the magnifying glass. That's more critical assessments after birth. Folks, intentionally or not, hunting for signs of lowered competence. It's very common in the workplace. It's also very common with students. And then we see the time warp, right? Thinking that fathers couldn't possibly be centering their family. Isn't that your wife's job? I thought you were a serious student. I'm so disappointed. You don't belong here anymore. The last set I call the attorney's dream. These are just egregious on their face. I don't think I need to explain that. Asking a student why they don't have an abortion or telling them they shouldn't have an abortion, asking who their baby's daddy is, or just telling them they should stay at home. All of these are really egregious violations. And unfortunately, I hate to share this, but all of these are real examples from students who've reached out for assistance. So we'd like to think that we've left this sort of mindset behind, but it's still out there. And the key is to have systems in place that are going to catch these problems before they spiral into the student actually just staying home with baby, right? We want to have a complaint mechanism that is clear, that it's open to pregnant and parenting students, and ideally also more trainings for folks so that they know to avoid this. Here's an example of a harassment case. This is Tina Varlisi, a fabulous, fabulous person who's very kind to let me use her photo. She's a graduate student in social work at Wayne State. She had an internship placement as a part of fulfilling her degree requirements. She received some pretty egregious harassing comments and low ratings from her internship supervisor. During her pregnancy, it all centered around her pregnancy, her competence, and her sexuality. The school didn't investigate. There wasn't a proper investigation. Tina ended up failing that class with that harassing supervisor and was pushed out of her career. She sued, and the university ended up getting fined over $800,000. So this is what we're trying to avoid here. And I will say Wayne State has done some really amazing work to become friendly to families and pregnant students. But all it takes is that one supervisor to not know that they have an obligation under Title IX to end up in a situation where there's a lawsuit. Here's a case example of gender stereotyping. Again, taken from the real life here. Michael requested to miss class to take his newborn baby to the doctor. Other students have received excused absences for a variety of reasons, including extracurriculars and doctor's appointments. The professor responded by asking him to prove he's a caregiver and that his wife can't take the baby. The professor later said the absence would be unexcused, as there is no such thing as daddy leave. This just isn't something we do. I hope that you're seeing all the red flags here. First of all, assuming that a father can't be a caregiver, assuming that he has a wife or that he's married at all is certainly concerning. And then treating Michael differently from those other students who get excused absences for other reasons could be a form of Title IX violation. I've had students say, this other person in my class is out for a golf tournament, but I can't get out when my kid is deathly ill. What is that about? When you have that sort of disparity, it certainly lends to see, you should be seeing those red flags, right? Just realizing I'm low on time, I'll go through the next one pretty quickly. Stephanie's a sophomore. To get an abortion, she had to travel back to her home state. She missed a week of classes. When Stephanie returned to class, her professor told her there is no point in coming back. She's now missed 3 classes and will automatically fail. I know a lot of professors have these sorts of attendance policies. Regardless of that professor's policy, Title IX federal law wins. And federal law says if they have a doctor's note, if it's medically necessary, that absence should be excused. In this case, Stephanie gave the doctor's note to excuse her absence. The professor realized that her absence was for an abortion, called her to meeting names, and said he's reporting her to the administration. Stephanie's advisor suggested she withdraw before she's kicked out. I hope, again, all the flags are going up here. In a Title IX compliant institution, Stephanie would have been able to get an excused absence for those the time that she was off to receive that health care, as long as she has a note from a healthcare provider. And these comments would not be made, right? Again, this is another form of harassment under Title IX. Looking back to that long list of everything that's covered, if it's pregnancy related or if it's tied to sex and parental status, harassment and discrimination on that basis is illegal under federal law. And so I'd hope that Stephanie's advisor in the future would say, this is wrong. We need to make a referral to Title IX. Make sure you get the support that you need to be able to continue your education, rather than telling her to withdraw. All right. Again, gather your folks. A few what's next summaries here. Update the Title IX webpage with information about harassment beyond sexual behavior, right? Again, thinking of that broad set. I encourage folks to reevaluate their training. Does it include diverse examples of harassment and discrimination? You know, harassment's not always that quid pro quo. It can take these forms. Think about whether services related to parenting are provided in a non-discriminatory manner. We don't want to only support moms. We want to, or birthing parents. We want to support every type of mom, every type of dad, every type of parent, without regard to their sex or gender or sexual orientation. And we want to establish points of contact so that everybody knows who to call if they have that tricky situation. You might be thinking about that panic button now. Definitely seeing these key themes of the new regulations, there's certainly a lot more responsibility. The Department of Education has been pretty seriously enforcing the pregnancy portion of the regulations. Definitely with the Biden administration, have seen those investigation rates go way up. So I think, you know, this is a fantastic time with the new rules coming out to evaluate all of your processes, make sure that you are clear on who is responsible for what. In most cases, the Title IX coordinator has the authority and responsibility now, but I know they can't do it all themselves. So be thinking about that. And just closing thoughts as we move forward, you know, as you can see, the devil really is in the details and in the implementation. So saying we follow Title IX is not enough. Folks really need to know how and who is responsible. And I see these regulations as laying a foundation, but it's really up to us to build the rest. I hope we can eliminate that room for interpretation, eliminate that confusion so that folks have a clear set of guidelines. And I encourage you all, think about what parenting accommodations could look like while you're having these conversations. Think about what a family and pregnancy responsive culture could look like. I hope that the new rules in this conversation, you know, inspires you to dream big. Don't just meet the floor, right? But think about what we can do to create a truly family and pregnancy responsive culture. I again have that QR code. You can check out pregnantscholar.org for tools to help you on your journey. But in the meanwhile, I'm just really excited to dig into questions. Thank you.
Thank you so much for the presentation. That was very comprehensive, and I really appreciate the last few slides because I think one of the biggest things is how do we make sure everybody knows? How do we make sure that students know, that graduate students know, and then people who have points of contact know? And a lot of our questions dig into this with scenarios and questions. And we have a very robust set of questions, and we have about 15 or 20 minutes. So I'm going to hand things over to Jenny, and she's been consolidating some. So if you asked a question, we tried to pull it from both the chat and the Q&A, and we'll just see how many we can get through in the next 15 minutes or so.
All right. Hi, everyone. Thanks, Jessica. That was just really amazing and informative. I have tried to consolidate this sort of into questions focused on regulations, questions focused more on like informing students, and then maybe what instructors might need to know. So kind of trying to categorize them a little bit. So for those of you watching the Q&A or the chat, we won't be going through them necessarily in order, but more so in terms of topic. And I'll just start with the regulations. This kind of ties back to, well, I guess it's what you ended with, but then also started with. And the question was, the process of determining accommodations is very similar for students with disabilities. Students with disabilities require some level of documentation of disability. Did you say that under Title IX, you do not need to provide any documentation to determine what's reasonable or appropriate?
So there is no legal requirement to provide that documentation, but documentation can be requested. I'm curious what the final Title IX regulations are going to say about this. I know there's been a lot of work over the last year in the employment space, setting up these documentation standards when it comes to accommodations and adjustments. But again, the devil's in the details, so we're going to see. But I would flag that the Title IX accommodation process is a little bit different in a few ways. Of course, the student doesn't have to have a disability. The regulations don't even require that student to have a formal diagnosis to be eligible for accommodations. So, for example, if we're talking about disability and there's a student who has morning sickness, they might not meet the test of disability, right? We might want them to submit some doctor's notes saying they have hyperemesis gravidarum. They are completely incapacitated by this. And then you have the accommodation talk. When it comes to Title IX, it would be enough for that student to say, hey, I'm pregnant, here's my due date, I'm experiencing really bad morning sickness and I need help. They should not have to go to a series of experts to prove what their condition is. So long as it's a pregnancy-related condition, it doesn't have to meet a certain threshold of severity to warrant making changes. And so that I think is really big news for a lot of folks. Check out the rules for more on documentation. That usually trips people up when people are coming back from leave. I see some like leave or withdrawal policies when it's for a medical reason. They say, all right, you have to submit all this paperwork to return. We have a committee review to see if you're suitable to come back. That's when I think the documentation is going to be the trickiest. But yeah, it should be a pretty low bar when it comes to the adjustments.
Thank you. A couple of the questions here are really talking to just some making sure they're defining things correctly, and also understanding sort of how much you might think that the published rules are going to change between now and then. So someone asked, when you're referencing updated regulations, are you talking about the proposed rules? Just to be clear in that. And then there was sort of a follow-up comment that was indicating, well, we don't really know exactly what they're going to say, but do you have a sense of what that might look like?
Yeah, so I tried in this presentation to flag the things that I was uncertain about. I'm uncertain about it because I'm part of a national coalition of attorneys and advocates working on these issues. We read way too many of the public comments. We wrote dozens and dozens of pages to the Department of Education and have had meetings about some particular points that seem to be the sticky points. So I definitely did flag those. The other ones, like, for example, including lactation as a pregnancy-related condition, I would bet every every penny in my bank account that that's going to be in there for various reasons. We don't have enough time to go into it, but I feel pretty confident about what is included in this presentation today.
Great, thank you. We'll talk about some students. So there was a question about what's the best way to inform students. So it says, what's the best way for Title IX offices to inform pregnant or potentially pregnant students about their rights?
Yeah, I think Title IX coordinators and offices are going to be facing some pretty heavy burdens here with these new regulations if they are what we expect them to be. So if that was me, I would have a video, maybe a handout that you give to every student who comes your way saying, here are the basics, right? If you have a health condition, you can't keep up with your schoolwork, here's what we'll do for you. If you need time off, here's what that conversation is going to look like. So cover your bases by having something that is template and boilerplate. And then give students the pathway to flag themselves as needing more than that. So that way you're not totally overrun having an hour meeting with every single pregnant student who comes your way, but students have something to refer to, they have something that they can share, and they know exactly where to reach out if they need more in-depth counseling. A lot of students, probably the majority, don't want much at all in terms of adjustments. I can't tell you how many students call my helpline who say, I plan to be back at school 2 weeks after giving birth, unless unless I'm in the hospital, I will be back. So I'm hopeful that having some of that boilerplate language will help control the workload. But I think the name of the game for all of this is make sure they know who to go to if there's a problem. And same thing with faculty. If a faculty member can grab a new chair and it's very easy for them to do, I don't want them to have to go to Title IX to get that new desk for the student, right? If it's easy and immediate, go for it, is my perspective. But they need to know that for those cases that are a bit trickier, there is a legal framework and they need to know who to go to for help with it.
And I think that's kind of where the next two questions actually also line up really nicely just with your last comments. One is, and they sort of tie together, so I'll read them together. It says, if a student reveals that they are pregnant, the thing we should do is immediately refer them to Title IX on campus, correct? So somebody's asking, is that where we should send a student if they reveal they're pregnant? And then on the opposite side, from the faculty or instructor perspective, it says if a student reports to us the pregnancy or the need, what are our obligations, especially if the student is going to miss class, and how do we handle that as instructors? Or is there other people we should talk to?
Right. Yeah. If you're comfortable making a quick change, if it's something simple like granting one excused absence, right, or getting them a new desk, my response to any of the students I work with would be, thanks for telling me. You have rights under Title IX. The Title IX coordinator can help you understand if you need more changes, if you need more time off, or if you have any problems. You can go to the Title IX coordinator. For the thing you just flagged for me, I can do that right away. I'll handle it. Don't worry about it. Right. So I like doing two at once. That way you're really covered. They know where to go, but you're not forcing them through a bureaucratic process. But I think, it is incredibly important to incorporate an awareness of pregnancy and parenting issues when you're training your faculty. If you're doing those mandatory Title IX trainings and they're not including this population, that's a real missed opportunity, because a lot of the violations just come in that first conversation with a very shocked professor happens to say the wrong thing.
Yeah, and I think that's there's a couple questions here about what happens if a student fails, to the point, or like is missing to the point of failing. So if they're missing a lot, then where as an instructor do we step in that case and say, okay, I understand these are your rights. Like, what can I do to help, or what do I do? What do I need to do, I guess? And so what is the point, I guess, for the instructor, or maybe what are the resources for the instructor that they need in that process?
Yeah, I mean, the ideal situation is one where the student comes forward and says, "Hey, this is what I'm going through and I need help." But that doesn't always happen. I try to have conversations with students if I see a sudden drop in performance, what's going on and what can I do to support? Hopefully they will tell you then. At a certain point, they might be showing, and you say, "Hey, if your absences are related to pregnancy, you do have some rights there. Contact Title IX. We can help get you some makeup credits for what you're missing, but we want to make sure you stay on track," right? So always that positive. I know you want to continue your education. Please talk with me or the Title IX coordinator about how to do that.
And there's one specific question here about, and you started to mention it, that especially with there are policies in professors' syllabi that are like each student is allowed 3 absences, no questions asked, or I'll drop the lowest exam score. And so somebody says, I often encounter this policy issue. Students will come to me and let me know that they used up their absences earlier in the semester, or now they need to be absent, and now they need to be absent for pregnancy, or they were hoping to drop their first exam due to poor performance, and they don't want to use that drop now because of pregnancy, but the professors don't want to budge and believe they have a built-in accommodation in their syllabus. This person indicates, I believe that absence or dropped exam policy available for all students is not quite an accommodation. So should the pregnant student be able to get an accommodation in addition to what the other statements are in the syllabus? And they ask, what do you think, or how is the best way to explain this to instructors?
Yeah, absolutely. I mean, if all students are getting it, it's not an accommodation, right? Everybody by now has seen that graphic where there's people standing on crates looking over a fence, right? Our pregnant students need the boost because of their health needs very often. So it should be in addition to what other students are getting. So if that professor has a 3 absence policy, the student missed 3 absences, and then they have severe complications, which mean they need to miss a week or 2, that extra couple of weeks that are medically necessary should not be held against them. They need to have an opportunity to make up any credits or assignments that are missed. And students should not be automatically failed for pregnancy-related absences. I would treat them in a completely different category. And as to how to convey that, make me the bad guy, make the lawyers the bad guy, throw the Department of Education under the bus if you have to. But I've had this conversation a million times. I know it's really challenging to talk with faculty members about giving up control over their classroom, over their policies. I know that's a terrible feeling for all involved, but federal law wins, right? Federal law trumps what's in the syllabus.
Well, and there's a follow-up question with this one that is, it's not technically follow-up, but it seems to be right in line with this, that it's a student asks if a lecture-based class is possible to do online, and the instructor is resisting. They're saying that this class is meant to be in person. And so it says, how can we determine if it's a reasonable accommodation for pregnant or parenting students when faculty are struggling with resetting expectations with all students post-COVID and virtual learning?
Yeah, that is a huge, huge challenge. I know it's giving a hybrid course is incredibly difficult. Remote learning is one thing, in-person learning is another. Doing both really stresses a lot of faculty, and I think for good reason. But again, that federal law wins. So if the choice is between that student delaying graduation a semester or the professor turning the camera on, in most circumstances, I would say the students' need to have that course wins. But I do think it all depends on the individual circumstances. So is it 3 months of that student attending virtually? Is there a ready system for them to participate virtually, or would they just be watching it? That is probably different from a student who just needs a few weeks. Are there actual concerns about the content and character of the course, or is it just a professor saying, I don't want a camera on me? Those are the factors I consider. In a vast majority of circumstances, it is reasonable. But if for some reason it's just not doable, then you need to look to other solutions. So maybe it's having a note taker for a few classes, or maybe it's having that student be able to waive some co-requisites to take that course again next semester, but stay on track, or transferring in credits. There's a million and one things that you can do. I think if you're in the process of having these conversations, you are definitely getting there. You're on the right track. The thing I don't want to see is that student making the request, getting shut down, and then being forced to withdraw. We need having all of those options on the table.
Yeah, and I'll just ask one last question. This is for our employee category, and then we'll close out for the day. Can you provide any resources on maternity leave for employees? Our current institution does not have anything regarding maternity leave in the policy handbook, and when asked, HR has sent contradictory messages. You can only use vacation time, which is 4 weeks, maybe use sick time, etc.
Yeah, that's a whole extra hour of conversation. I'm just sharing in the chat here. Our sister program, we have Pregnant at Work and Pregnant Scholar. Pregnant at Work has resources about the new laws that do require time off for pregnancy related conditions, maternity leave. And there's also a helpline. So if you're in a pickle where you're just not sure, when does FMLA apply? When does your paid time off or disability policies apply? You can call us and we'll actually give you a review of all of that and help you understand how all of these various options work together.
Oh, that's amazing. What an amazing resource. So thank you so much. I'll turn it over to Steph now, who can say last few words. Thank you.
Well, thank you everybody for all of the fantastic questions and for the facilitation, Jenny, and the thorough answers. I thought this was super informative. I just wanted to flag one comment that came in because I think a lot of the conversation shows that there's lots of room for interpretation in favor of the student. So even though the letter of the law doesn't require it, there's lots of chances and opportunities to also do the right thing. And someone had mentioned the dean of students and just referring students there also for a culture of care. And I think that's really important. Also because it's about pregnant and parenting students. So after having a child, anybody with young kids know there's a lot of opportunity for your household to be sick, for daycare to not be able to take kids because they're unwell. And I think reaching out to the dean of students to continue to have a network of support so that students have an interface between their instructor and the other activities they're involved in is just really critical. And I think that speaks to a lot of the scenarios that people ask for and some that we didn't get a chance to address directly. But I think there's always room and always opportunity to decide in favor of a culture of care. So thank you for that comment. This was fantastic. We will have a recording that we'll distribute sometime next week to the distribution list, and people can also contact me directly for it. I'm not sure, we'll share out some resources. Potentially some of the slides that were shared. So I will get all of that information out to the listserv next week if you registered. And the task force does have more events coming up for the remainder of the year. We're going to have a meeting in a couple weeks with our gender membership and just think about what's happening on campuses and where we want to go. And then we'll also have a STEM-based conversation later this semester as well. So continue to check in and connect with us as you're able and reach out for questions. But again, I wanted to extend my appreciation to Jessica Lee for joining us today and for all of the helpful insight on the upcoming changes that we're hoping to see very soon.
Thank you so much for having me, and thank you for all the amazing work that you are doing. I love the questions, and I love this commitment to creating a family responsive university. Thank you all.
Yep. Thanks, everybody.